Minister, are you aware of the many services community pharmacies like mine do for my patients for free based on my prescription income, such as home deliveries, free blood pressure checks, opening late and on weekends late, just to name a few? I will not be able to afford to continue these services if the 60-day dispensing proceeds. How is it that this does not leave my patients and my community worse off?
So, Joseph, just quickly, I just want to check with you on this. We're obviously talking here about the announcement the Minister's made to allow people with a chronic illness to have 60 days of medicine rather than a 30-day script. Are you saying that your pharmacy won't be able to open on weekends as a result?
Absolutely.
You'll have to shut?
Well, we'll have to look at the services that we provide. So it's just a matter of mathematics more than anything else. Less income comes into the pharmacy. How are we supposed to pay our pharmacists, our staff? It's just not possible.
Okay, Minister.
So the decision I took last week was to accept advice that had been on the table for 5 years, which is that people on stable chronic disease medicines can get 60 days dispensed medicine instead of 30 days. This is very common around the world, the UK, Canada, many other countries besides. And what it will do is halve the cost of medicines for 6 million Australians. Will halve the cost. Will halve the number of times they have to go to a GP to get their repeat script renewed. Now, every dollar that we save as a Commonwealth government, we will be re-injecting back into community pharmacies so that you can do more of those services. We announced some on Friday. We'll give access to community pharmacies to the entire national immunisation program, to opioid dependence. There will be more announcements that we make. So every dollar we save in the budget will go back into community pharmacy. But I don't make any apology for halving the cost of medicines for 6 million of the most vulnerable Australians who occasionally are on these medicines, not just for years, but for decades, but have to go back to a pharmacy every single month to have their script refilled. This was advice from the experts that the former government, for some reason, decided not to follow. I've decided to follow it.
So if the money that's being saved here is all going back into community pharmacies, are you saying that Joseph's pharmacy should be able to do all the things it's doing and stay open on the weekends? Well,
there will be a saving by consumers, not the Commonwealth Government saving. We estimate that will be about $1.6 billion over 4 years. But to put that in context, community pharmacy will earn over $100 billion over the next 4 years. So we're talking somewhere in the vicinity of 1 to 1.5% of their revenue, and that's going off the pharmacy's own numbers.
Okay, but will Joseph have to wait for Tuesday night as well to see what more might be coming to...
It's going to be a big night.
It's going to be a big night. Does any of that give you any confidence?
I mean, it's just a case of mathematics. On the average, $175,000 is taken out of each pharmacy income, gross income in a year. Where am I supposed to get those funds to pay my pharmacist? I'd like to have an answer to that, and so would every out of 5,800 pharmacies in Australia. We wait?
Well, I just gave the answer, which is that every dollar we save, we're reinvesting back into community pharmacy. I want to see community pharmacists deliver more services, not just processing repeat scripts, but delivering more services of the types that I just talked about. But I'm not going to make 6 million patients with chronic disease, many of them pensioners, continue to pay a monthly fee to pharmacists when the Medicines Authority said 5 years ago they shouldn't have to do that. Since that time, over 5 years, hundreds and hundreds of millions of dollars have been paid out by those patients when they didn't need to.
Sarah, let me just ask you on this. As the Minister points out, there are plenty of other countries that give 60-day scripts. It makes it a lot cheaper for them, those with a chronic illness. This has been, as he points out, the recommendation of the authorities here. What do you think from an international perspective about a move like that? It might hurt some local pharmacies, though.
Well, look, I mean, obviously I don't know anything about the specifics of the numbers or the investment, but you know, assuming we can take the minister at his word that he's going to invest it back to make sure that those services are covered, then it sounds sensible to me. I certainly think that for any of us as individuals, when we have to pay for prescriptions, anything that seems to be creating opportunities where, forcing us to do something that we have to do for our own health, that is creating, what might seem like excess profit to some, if not to all. I mean, I grew up in the United States, which has one of the most free market approaches to medicine in the developed world, if not the most.
You can get your drugs at the supermarket.
And well, you can get anything at the supermarket, including guns, in America, because it is such an extreme free market and so very deregulated now. And having lived now for 20 years in the UK with a National Health Service that does cover prescriptions for chronic illnesses. I mean, I have low thyroid, and the NHS covers that for me. It's incredibly important for people that they have access to those kinds of services. So I'm just glad to be listening to a conversation where people are actually taking that seriously.
Bridget Archer, where are you on this one? Do you support what the minister's doing here, or do you support the local pharmacies?
Well, I think what I want to avoid is exactly that sort of either-or situation. I think it needs to be a conversation, and I think we do have to, of course, listen to patients, and we should always have patients at the centre of what we are seeking to do.
Sounds a bit like you're sitting on the fence, though,
no, but I think as part
with respect.
of that, the conversation we were having earlier about the kind of health ecosystem, community pharmacists are also an important part of that. And I don't want to see a situation where we're sort of, having an argument or positioning community pharmacists as something, as the bad guy, because they're not. And they fill an important role in our health ecosystem. And if they are raising some concerns, it's reasonable to listen to them. And I think it's around cost. But, pharmacists have also raised some of those issues about their concerns around stockpiling of medications or medication shortages, the advice that they provide to patients when they're seeing patients regularly as well, particularly if they're not able to access a GP in the same way. So, whilst I see what the minister is trying to achieve, I would urge, of course, that we listen to the voice of community pharmacists, and that we don't play people off against each other.
Sorry to butt in, but what does that mean? Do you go to the 60-day scripts for people with a chronic illness or not?
Well, I think that part of the issue that pharmacists have raised is they don't feel that they've been consulted about that. And so I don't necessarily have a view around whether that is the right way to go, or whether it's the right way to go in isolation, or whether we need to also listen to pharmacists about, OK, if we're doing that, what else might we need to do to ensure the ongoing viability of community pharmacy? Because if that is threatened, then we are complicating and worsening already a difficult health ecosystem.